Of partial pulpotomy in immature permanent teeth with symptomatic irreversible pulpitis, a prospective case series assessment published in 2023 in the JOA. The aim of this clinical report was to assess prospectively the clinical and radiographic outcome of partial pulpotomy in terms of pulp survival and continuation of root development using commercial brand of MTA as a capping material in symptomatic vital immature permanent molars after pulp exposure due to caries. The inclusion criteria included immature permanent teeth with no contributory medical history, extremely deep caries that extend into the pulp chamber, positive response to cold sensibility test, and presence of spontaneous pain or provoked lingering pain to cold stimulus, and the tooth should be restorable. All the procedures were performed by the same operator with more than 15 years clinical experience, and the follow-up clinical and radiographic examination were scheduled at 3, 6, 12, 24, and 36-month interval. The teeth were clinically examined and for signs and symptoms such as pain, discomfort to percussion, swelling, sinus tract, presence of periodontal pocket, and absence of positive response to cold test. Clinical examination was performed by the same operator. Radiographic evaluation was done by two calibrated experienced endodontics that include the assessment of periapical status to the completion of apical closure and the formation of calcified dentinal bridge beneath the capping material and the possible presence of internal resorption or root canal obliteration. And the quality of the crown restoration was also assessed clinically and radiographically. A total of 33 young patients were recruited and prospectively followed up. 15 were female and 18 were male, and the median age of the patients was 9 years old. The patients and their respective teeth were followed up with for a median of 2.4 years. No failure were detected for the entire of the follow-up period. At the end of the assessment period, considering the last day of the assessment of each tooth, all teeth presented normal periapical tissue in the radiographs and formation of dentinal bridge was found in 100% of the cases. Signs of partial pulp chamber classification were detected in two teeth, and the quality of the restoration was adequate in all but one case in which the restoration was replaced because it was not considered acceptable during the follow-up appointment. No crown discoloration was detected, and apical closure was confirmed in all teeth, and all teeth functionally was intact. Therefore, successful outcome was observed for the entire of the examination of the examined samples. In conclusion, the result of this prospective case series showed that partial pulpotomy is a highly efficient treatment option for management of vital immature teeth with symptoms of irreversible pulpitis. It is the least invasive technique, preserving a great amount of coronal pulp tissue, which most cases remains vital and healthy without further complications.